Dr. Ashok Seth, so for example, a lot of the cases that I cited are from walks of life, professions which are supposed to be high pressure, whether it's the entertainment industry, for example. Their routines are all over the place. In certain roles, Dr. has said they'll have to gain weight, then lose weight. There's always the added access and temptation to all kinds of vices and substances. Despite the fact that they all look so fit, is there a possibility that they were perhaps not genuinely that fit?
So firstly, of course, we were all shocked at this young man's, Siddharth Shukla's death. We feel sorry, condolences, but it's, sometimes these are harsh reminders of what realities are and how heart disease has increased in the youth in this country over the last 15 years by 300%. And we have become, by the way, the world's capital of heart attacks, as you perhaps know by this time. 50% of world deaths happen here. The other reason why we're seeing deaths at younger age group is for two important reasons. And while I don't go into the causes or the usual causes, when we are getting heart attacks at a younger age, 10 years younger than the West, and when more heart attacks happen in the young, when a lot of them would present not just as major heart attacks, but as more of a cardiac death, because 50% of the deaths from heart disease actually occur as sudden death. Now, you really asked an important question. Is just because we exercise and just because we bodybuilding and just because we look fit, and I'm not saying this for Siddharth, I'm just an important perspective about heart disease to the public and audience, is the fact that building muscles, actually looking fit, is not necessarily heart health. Heart health is totally different. For example, if I can build muscles, all I'm doing is actually physique, but that is neither good cardiac exercise. In fact, in many ways can be detrimental, and that's why you hear of some situations of extreme exercise landing up in heart attacks. And finally, it's very important to realize that you may actually harbor blockages, which are early, which can be 30, 40%. Blockages do not cause any symptoms till they get beyond 70%. And these blockages get worse, suddenly lead to heart attack, and suddenly lead to cardiac death in situations of extreme exercise, smoking. And by the way, even pollution and increasing pollution has actually been known to create heart attacks. And perhaps that's one of the reasons for the increase which we see in the last 10 years. Even today, a study presented said that we probably decrease our lives in some of the urban cities by close to 15 to 20 years just because of pollution itself, which is known to harm coronary arteries and known to create heart attacks.